Welcome to our live podcast. I don't know who all's out there in the world, but thanks for watching. I appreciate it. My name's Dr. Hamilton. I am the medical director of Telemedica, and I'm glad to have everyone here. I've got my lead physician assistant with me, Sabrina Vizzini, and she's going to be here helping answer some questions as well. But thanks for coming on. I do appreciate it. We wanted to spend some time discussing the new structure of Telemedica, and I think it's really going to be beneficial for you. I think you're going to get a lot of value out of this. It's going to streamline some systems. It's going to unite some groups and allow us better communication between teams. And I wanted to kind of cover that. So going forward, I'm going to be the medical director for both what I'm calling the diagnostic team of telemedicine, as well as the Nexus letter writing team. And the reason that that's going to be beneficial is in the past, those teams have been separate, and yet we kind of could communicate, but it wasn't very smooth, efficient. I guess, or efficient. And there were a lot of questions that we would get on the diagnostic side and the evaluation side that really needed to go to the Nexus letter team side. And now that we've got those teams united, we were going to have a much smoother process and be able to answer those questions better. So to sort of back up, let's cover real quickly just the differences between the two teams and how we can best help you when you're coming with your questions, whether it's today or in the future. So when we see a veteran for an evaluation for a medical condition, and we can talk about those 17, is that what we're up to now?
I think we're up to close to 20, yeah.
So yeah, 20 medical conditions that we can evaluate you for on a first-time basis to see if you meet the criteria for diagnosis. And that would be on the diagnostic medical team, where you would see either me or Sabrina, and we'd go through a list of questions. And honestly, it doesn't take that long, and you don't have to have a whole lot of information with you. It would be very similar to going to the doctor's office and saying, hey, I've been having these headaches. I'm not sure if they're migraines, but can we discuss it? You don't have to have paperwork. You don't have to have previous evaluations. You can, and that's great, but this can be completely blank slate, just like it would be if you went to the doctor for the first time. So you would see Sabrina or me for that. Now, if you have the diagnosis, or if we decide, yes, you meet the criteria for, let's use migraines as an example. You meet the criteria for migraines. Then what we're going to do is we're going to put you in touch with our Nexus letter writing team. That team is going to be responsible for service connecting those migraines. And they're going to do a true deep dive into your medical records, into your service records, into your buddy letters, all of those things. They're going to create a huge amount of detailed research to connect the diagnosis that we give you on the medical side and the service that you've provided to our country and through your military, and make sure that they create a great report so you can then take that to the VA for your disability claim. And the reason that that's going to be nice is as our Nexus letter team has questions from you that they need answers from us, it's an easy, quick phone call. We're now all united under the same umbrella of Telemedica. I'll be the leader as the medical director, so I'll be the liaison between both teams. We may even have team members who do some diagnostic stuff, some Nexus letter stuff. So there's going to be some integrated training on our end too that's going to benefit you as the veteran, so that we know when we're working on the diagnostic side exactly what they're going to need on the Nexus letter side, and vice versa, so we can really better help you. So I'm going to turn it over to Sabrina real quick and just let her, do you have a list of the 20 or so conditions that we can talk about? Because I want to make sure that everyone knows these are the conditions that you can come see us a first time for. Once we cover that, we're going to then kind of step into the next topic, which is if you already have the diagnosis, what we can do. So Sabrina, talk to us just for a sec about the 17 to 20, and this list is growing, so bear with us. We may come up with stuff that we're like, yeah, we can evaluate that. So these are the 20 or so that we've said, hey, this is something that we can reasonably diagnose over the telemedicine platform. But let's I'm gonna turn it over to Sabrina real quick. I've been talking too much.
Sure. No problem. Talk as much as you want. So as Dr. Hamilton said, when we do your report, you're going to get an IMO. It's going to contain your diagnosis and something called your Nexus statement. Okay. That's kind of like step one before we send you over to the Nexus letter team. Nexus statement is kind of like the bones that starts to connect your whatever your diagnosis is that we give you to your service. And then the Nexus letter team is going to take a deep dive and give the why. Okay, so this provider said that, yes, this is service connected. Why is it service connected? Because the more ammo you can have and the more information that you can provide in your claim, the better your chances are. As far as the conditions that we can evaluate without you having any previous medical documentation, we have headaches, all kinds of headaches. So the migraines, tension headaches, cluster headaches, pretty much any kind of headache. GERD symptoms, IBS, radiculopathy, neuropathy, any chronic joint pain, so chronic back pain, chronic knee pain, specifically like patellofemoral syndrome, that's a big one for us. Plantar fasciitis is another one. But we've done anywhere from tarsal tunnel syndrome to rotator cuff tendonitis. So joint pains in general were pretty easy for us to do. We've also done erectile dysfunction, female sexual arousal disorder, and we've recently added on depression, anxiety, and PTSD, which we can do without documentation. We also have derm conditions, just about any derm condition we can do. Well, the acute derm conditions, there are some of the more complicated ones that need skin biopsies, but most derm conditions we can do without any prior medical documentation. Am I missing any? IBS, GERD? I feel like I'm missing some.
Did you talk about the chronic
fatigue syndrome, Gulf War syndrome? Yeah, those are big ones. I don't know how I forgot it.
Yeah, and there's a lot of overlap, I'd say, between chronic fatigue, fibromyalgia, the somatic symptom disorder, and so those categories are so closely linked. I think that it's very reasonable for us to evaluate you and see kind of which of those categories you fit into best, because I'm not sure that it really matters, and there's so much overlap that it's really just going to be an interview that we're going to have and a conversation that we'll have to have with you. So,
yeah. So basically all of these conditions that we're naming have something called clinical criteria for diagnosis, which is why we don't need any lab results or any x-ray results or any other documentation from any other writer, because these have a very specific clinical criteria. If you meet these symptoms, then you qualify for this diagnosis. So basically any condition that has a clinical criteria diagnosis, we can see without additional documentation. We've recently started seeing chronic conditions such as, I just did a Crohn's the other day. So chronic conditions, though, we do need the at least lab result or the biopsy or whatever test confirms your chronic condition. For example, for this example, Crohn's, it would be the colonoscopy results showing that you do in fact have Crohn's. Hypothyroidism, the lab test that shows that you have low thyroid or diabetes, the A1C test. So, but as long as that's, and say you go see a specialist, because I know there's a lot of specialists that don't want anything to do with the VA. They don't want anything to do with Nexus statements or Nexus letters. So they'll see you, give you the diagnosis and treat you, but they won't connect it to your service. That's where our IMO and Nexus statement comes in, and then we move you to the Nexus letter team, and they can help say why, because there's a lot of diagnoses. I just did a MS one with her documentation. She was getting treatment, but it wasn't service connected, and that's one of those things that the VA calls a presumptive diagnosis. If you have symptoms of MS that start within a certain amount of time frame after you leave service, it's presumed to be connected to your service. So then she had got her IMO from me with the Nexus statement, and then the Nexus letter team will do a deep dive into the research that shows why, in fact, that should be connected to the service.
Yeah, and even some of the veterans that we've had who have had the diagnosis have gone to try to get Nexus letters, have been able to get Nexus letters. They've been turned down because apparently the diagnosis was too long ago, which kind of seems absurd to me. But the benefit of us now uniting the Nexus letter team with the diagnostic team is our Nexus letter team can reach out to me and say, hey, look, can you just quickly interview this veteran, take a look at their previous medical records, and basically give an update. It's like, yes, this is still present. This is, this diagnosis still holds. That thankfully hasn't been common, but it's been common enough to where we've had to address it. So I want to make sure that if you've got a chronic condition that for whatever reason you've been turned down for, we can evaluate that. But there are that's the one area where there's certain criteria that you're going to have to kind of bring to the table. That's not to say that you can't provide us the documentation after we do the interview, but like Sabrina talked about with Crohn's, we've got to see your GI report. We've got to see the colonoscopy report. Again, you don't really have to have it right then, but before we can finish the report, we're going to have that so we can review it. But I think that'll be really beneficial to a lot of people who may have had diagnosis in the past and been turned down and need some reevaluation.
Other people that I've seen turned down they got a Nexus letter and that was all fine and good, but they hadn't had a recent exam. So that's another thing that the diagnosis team is good for, because even though it's telemedicine, so many things are going virtual now and so many more, even mainstream Humana, UT Southwestern, many big companies are doing a lot of things virtually, and there's so many virtual healthcare companies that are popping up, telemedicine companies that are popping up, that our telemedicine encounter does count as an exam. And you can ask any of my joint pain patients that they get put through an exam.
Yeah. So if COVID has done anything good, it's actually really helped the telemedicine world. So that should benefit you guys in the veteran community immensely, because the VA is now having to accept that this is a real medical evaluation and that we're going to proceed accordingly. So that is something that we're really able to kind of grow with the telemedicine platform on. And it's been a real benefit, if anything from COVID has been beneficial. So we're really trying to use that. Let me take a minute to back up. I should have probably started with this, but so I know I told you who I was, I told you who Sabrina was, but give you a little bit of background on me, and I'm gonna let Sabrina give you a little background on her. So I'm board certified in emergency medicine. And the reason that I bring that up is some of the questions that I've created to ask you, as well as to have Sabrina ask you, are geared to make sure that you are safe. And when you see us on the other end of the video, I want to make sure that if you're answering any of these questions that may seem silly to you, but if you're answering them in the positive, I want to be able to say, okay, we need to stop. I want you to go to the ER right now. I am worried about this, specifically with things like headache, because there's certain things that headaches can be really dangerous, and we need to evaluate that in person in an ER right then and there. Same with other conditions. So I bring that up because my background being in emergency medicine and acute care, I want to make sure that you guys are safe. And to this point, we haven't sent anybody to the ER, so that's great. But I want to make sure that you know that we are trying to take that into consideration and make sure that you're safe, and make sure we're doing a thorough evaluation, not just for your medical condition, but just for your overall health and safety. So, but that's my background. I've been working with the veterans for over a year now, and it's been a great experience, been very beneficial. We've been able to help a lot of veterans get diagnosis. I'm excited now to unify the platform and get the Nexus letter team in our group as well, so we can better communicate and work with y'all as well. I'm going to let Sabrina talk to you a little bit about her background, just so you know, hey, when you're talking to one of us, this is who we are.
Well, thank you. I'm also a veteran, so this is a pretty personal mission and endeavor for me, making sure that our veterans are taken care of as they're supposed to be and appropriately. I joined the Army straight out of high school at 17, went through the Army's PA program, became a PA through the Army, served 4 years as an active duty PA, and then served as a National Guard PA. On the civilian side of the house, I work at a family practice PA in Dallas. I've deployed a couple of times as a medic and once as a PA. And through my time in the service, I've gotten to meet a lot of good service members and veterans, and I enjoy taking care of you guys.
Indeed. So I'm really glad that we've got a strong team, both on the diagnostic side, so that if you need to be evaluated for the first time or reevaluated because it's been some time, as well as the Nexus letter team, so that we can better communicate with our teams and better serve you in the long run, so that if you have issues that come up like, hey, I got rejected for X, Y, or Z, then we know which team you need to talk to, because it may be the Nexus letter team that needs to go back through, comb through, and see if there's anything that was missed. Or it may be, oh, hey, you haven't had a recent examination. We need to get you to the diagnostic team to see you, and do a recent evaluation and review your charts. So
and I
some
think
of those
that's
things.
a good point, that just because your first time go around, is not deemed service connected, they tell you why. They give you reasons why. So you can come back to the table and we can evaluate that and see if we can and help you with those adjustments so you can go through and have a more successful outcome the next time.
Yeah. And our questions are very objective. We have criteria. We're going to ask you questions, and if you meet the criteria, great. You've got the diagnosis. We can move on to get you to the Nexus letter team. And if you don't, we want to have that conversation with you as well. To date, I'd say over 95. I don't know if it's not 100%. We've had a few that didn't meet the criteria.
I would say
but
maybe
it's
90%, above 90, I think, right?
It's not common. Most of the people who have concerns are dealing with this condition long enough to know, hey, look, I think that I'm struggling with migraines, and you've probably looked into it. You probably know. So the reason I bring that up is I want to make sure that you all know that what we're doing is very objective, and we're doing that to maintain credibility, so that if the VA ever comes and looks, they're going to look at your evaluation, they're going to look at your diagnosis, and they're going to look at our reports and say, yes, this was an objective evaluation that was created by medical professionals and evaluated by medical professionals, so that we can, again, best serve you and give you the best chance that you have of getting the disability rating that you deserve, as well as keeping you safe. Sabrina,
and the other thing that happens sometimes is they'll come and schedule an evaluation for a condition they think they have. And just because symptoms don't meet that criteria, other times I can talk to them and see that their symptoms are actually more consistent with a different diagnosis. Same thing that happens when you go to any family practice clinic or the ER even. How many times do patients go in thinking they have X, Y, and Z because they feel this, but they actually have something else? That doesn't mean that the condition that you actually have can't be service connected in some way. So, still, I would at least schedule the appointment for us and let us do our evaluation to see what you actually have. And if you have something different, well, you need to know that anyways, because you need to actually find the appropriate treatment through your primary care manager.
Yeah, and that's important too, because we want to make sure that we're maximizing the value that you're spending with us, because these interviews, they don't take terribly long. That's the great thing about the telemedicine platform. You're not having to be waiting in a waiting room. There's not like a nurse that's going to pull you into a separate room and do all this other stuff, and then you got to wait again. So we try to streamline this and make it as efficient as possible, so that y'all get in and out, and we respect your time as best that we can. But we do want to be thorough. So if you've got things going on, let us know, and we can tell you pretty immediately, hey, this is something that we can talk about on the telemedicine platform, versus I don't know if this is something that we can talk about telemedicine. I think you probably need to see someone in person and have them lay hands on you, whatever, listen to your heart with a stethoscope, whatever the case may be. But, we've had great success. We certainly try to keep it efficient and respect your time, but I've had a lot of positive feedback from the veterans who actually really enjoy the telemedicine platform. You can do it on your phone, in your car, at home, in your break room at work. And so we try to be as flexible as we can, and help y'all out wherever we can, however we can.
Yeah, as Dr. Hamilton says, we try and make this as quick and as painless as possible. And that's why we've come up with all these diagnostic criteria, so that we can ask direct questions, so we can get you in and out. Because I know we have a lot of patients that sign up and they're doing it on their lunch break or on their 15-minute break or 30-minute break from work. So we're not trying to waste your time. We're trying to help you get what you need. That being said, the more information you can provide us with, the more thorough, the better. So we try and ask open-ended questions so you can give us the information, and that applies to you because you know your condition better than we do. So the more information you can share with us, the easier it is to write your IMO. And the more documentation you can upload, and the easier it is for us to write your IMO.
Yeah. And that will help us also communicate with the Nexus letter team, because they're going to be reviewing our documentation for the diagnosis as well, in an effort to help get you service connected. So that'll be a big benefit to you, to help us, discuss not only the conditions that you're facing, but also tell us your story. Tell us how it's impacting your life. And I don't just mean your work life. I mean your life, your home life, your personal life, your recreational life, because all these things, in my opinion, create a narrative that's incredibly important. Because if you got migraines that's limiting your ability to work, my guess it's also limiting your ability to go to your kid's baseball game or fill in the blank. And those things are important, because we spend probably too much time working in the medical world, but we spend plenty of time talking about work-life balance, and we probably need to act a little bit more on what we're preaching. But I do think that it matters. And so when we're talking about those things in your report, I want to be able to candidly discuss how the condition is affecting your life as a whole. Certainly, it's important to discuss the impact on your productivity, your ability to provide for yourself and your family, but also the ability to provide for your family includes your time. And if you're laid up because of migraines and you can't spend time with your family, that matters, in my opinion, and it should be in there. So,
and we definitely include it in the IMO. We have a section where we discuss how this is impacting your work life and your family life. So we definitely include that information when we do our IMOs.
Yeah. So, Sabrina, are we missing anything else? I know we had wanted to discuss the new structure at Telemedica, our team on the diagnostic side, the Nexus letter team. And we're not going to talk too much about their world because our lead PA there is not able to be on today, but we'll have another one where she'll be able to be on and discuss her work on the Nexus letter side. But we did want to make sure that everyone knows that those teams are now going to be united. There still will be two separate reports, but the communication between us will be so much better, easier, and more beneficial for all the veterans. I know we wanted to discuss that. I know we wanted to discuss the 18, 19, 20 diagnosis that we can do first time, as well as the chronic conditions that we can reevaluate. Am I missing anything?
We want to touch on that we added the anxiety, the depression, the PTSD.
We did.
So those are the only psych conditions, though. So anything else, I know there's so many: bipolar, schizophrenia, borderline. Those things really should be evaluated by a psych specialist. So, but I think we touched on everything that we wanted to talk about.
I think so. I know a lot of you have been putting comments on the side, and I've been trying to read them while talking to you at the same time. So bear with me. I'm still kind of getting my bearings on trying to talk and read the stuff at the same time. But I'm going to try to look through this and see if there are any questions. But please, if you've had a question in the past, so looks like we've got the lupus connection. So that's going to be that's a good question. It's going to be a question that we're going to need to send to our Nexus letter team, because they're going to be the ones that can dive into your report, both medical as well as your service, and they're the ones that are going to be able to answer that question better. Now, that having been said, they may tell you, look, you need a reevaluation, and you probably have some documentation that we can review and make sure that diagnosis is established. But as far as the connection, we'll need to make sure that we put you in touch with our Nexus letter team.
I can also tell you there's a lot of autoimmune conditions that are presumed service connected if they meet certain criteria. So you probably do have a good shot, depending on the time frame. Oh, well, thank you.
Awesome. We like to hear that. Also, if you happen to if you get turned down, we want to know that too. So as much as we want to make sure that we get everyone connected, we know that there's some reason that may not happen. And that so far we've been very fortunate not to have that common. But if it's not, just reach back out to us and let us know so we can say, okay, let's look into this a little bit and see, did we drop the ball on something? Sometimes it's silly stuff, like we missed a date or something, and it's just like a typo almost. So please don't hesitate to reach back out to us and let us look back into
Yeah,
it.
like we said earlier, the denial is not the end because they tell you why it's denied. So sometimes we can look at it. Maybe they need more documentations. Sometimes they want things worded a little bit differently. Honestly, sometimes, like Dr. Hamilton was saying, it's silly stuff. So it's not an additional charge to have us relook at it. So please have us relook at it if you are having any issues. We do want to know that because we want everyone to get approved. We want everyone to get service connected. That's why we're doing this. We're doing this to help veterans. So it upsets us actually when it's denied. And we want to know that so we can look into it. So not only to help you get your situation corrected, so we know and we follow that information away for future claims and to help future veterans as well. So Tom, for your Gulf War stuff, that's definitely something we can handle. That, that's those family of things that we were talking about. Chronic fatigue syndrome, Gulf War syndrome. If the VA keeps ignoring it, my guess is you probably don't have a documented diagnosis and exam to go with it. So you would probably be a candidate for the diagnosis team, which is my team. Sleep apnea secondary to PTSD. I've seen sleep apnea several secondary claims. We would definitely have to talk more about the details before we could just make a blanket statement. Would you agree with that one, Dr. Hamilton?
Yeah, we do. Let's see.
So that sounds TBI-ish. I mean, we've definitely seen more. The Nexus letter does more TBI than we do. I mean, just based off of that definitely needs more. We need to ask more questions and need more information before we can give you a good diagnosis on that one.
We can evaluate that, and probably what we need to do is put you in touch with the Nexus letter team first, because you may already have the information medically, and the Nexus letter just needs to work their magic and put everything together.
Yeah, we can get you with the Nexus letter team, and if they say you need a diagnosis, it's not hard to get scheduled with us.
Yeah, and that's the other thing too. If you end up with us and we realize, oh, you've got everything you need, you're good to go, we'll just send you over to the Nexus letter team. It's no big deal, and we can get that knocked out. If for whatever reason the Nexus letter team says, no, we actually need an updated exam, well, then, hopefully we can communicate that with them and get that scheduled, quickly. So
this is a good example of why Nexus letters are important. You have the diagnosis, but got denied from lack of rationale. So that's basically the Nexus letter bread and butter. It gives the rationale, it gives the why. So you would be a good candidate for the Nexus letter team.
Yeah, and to that point, in our report, we do try to touch on the rationale. Now, that having been said, we're not doing the deep dive and review that the Nexus letter team is doing for your service connection. But in that narrative that you're discussing with us, that story that you have on how it's impacting your life, that is part of the rationale, is that, yes, you have migraines, but this is something that's affecting your life. This occurred during your service. This is related to your service. Now, we're not going into the same details as the Nexus letter is going to, but we certainly want to discuss the impact it's having so that the Nexus letter team can say, oh, okay, all right, this is what's going on. And we use that to supplement. It's certainly not, supplanting it, so to speak. But we want to make sure that we're supplementing. We're make sure that we're helping.
To reiterate what Dr. Hamilton said, with the diagnosis team IMO, you will get a Nexus statement. So that starts the connection. That starts the connection from the diagnosis to your time in service. It's kind of like the bones, and then the Nexus letter is the meat. Okay, you could try with one, but really with these VA claims, the more information and the more rationale you can send up, the better. You want to have a complete picture. So we start building the bridge with the Nexus statement saying, yes, this is more likely than not service connected. Okay, well, sometimes that's not good enough for the VA. Like on this particular gentleman's case, they didn't have because we don't really dive deep into the rationale. We don't say why it's service connected. We say it more likely than not service connected. The Nexus letter is going to give that why, and that why a lot of times is very important.
Yeah. One. Okay.
Well,
Possibly.
if you have symptoms, yeah, possibly.
Yeah. And I certainly think you could file for both as long as you meet the criteria.
I've had multiple veterans file for both. So
one of the other questions I was looking over the side talked about a comprehensive review versus more of a focused review. Yeah. So this brings up something that I think is important, and it really is dependent on you. If you want us to talk about multiple conditions, you just need to sign up and say, look, I want to be evaluated for migraines, GERD, IBS, depression, or I just want to spend the time talking about migraines and I'm going to wait on the other conditions and I'll sign up and pay for those later. It all depends on you. Now, if we're talking about 3 or 4 conditions, the exam is going to be longer. Well, maybe not the exam, but the history part, the discussion is going to be longer. And so we want to make sure that we have the adequate time. So you may need, if we're talking 3 or 4 conditions, we may need an hour versus, 15, 20 minutes for one condition.
I've comfortably done like 3. I can comfortably do like 3 and 30 minutes. I would say any more than 3 at a time, we'd probably need to just book the second appointment after, which is usually not a big deal, just to give us a little bit more time, because we don't want to rush through the history taking either. So the other thing, as far as multiple conditions, so it also depends on primary or secondary claims. So say you have one and you're doing that one as your primary, and then you want to do all these others as your secondary, well, make sure your primary gets approved or, connected first. And then I would say make an additional appointment for your secondaries after that.
Well, and that way it's more efficient for the veteran. They're not spending money that they may not have to. And we want to make sure that you knock out that primary before you come back and spend more money to get the secondaries.
If it's secondary to another condition, yeah, we can see those at the same time. I would say 3 in a 30-minute block is probably, any more than that, I'm going to be hustling, and I don't.
Yes. So let's see. Short answer, yes. The Nexus statement from our independent medical opinion on the diagnostic team is different. And the simple reason is that we are not doing the detailed assessment of your medical records and your service records that the Nexus letter team is doing. We are having that conversation, and we want to make sure that we've got in there that, yes, this is reasonable that it's connected, but we are not doing near the detailed review that they're doing. So I think, again, it supports the Nexus letter, but it certainly does not replace it.
It's kind of like, the easiest way I can think of to explain it is our Nexus statement is a declarative statement. Your IBS is more likely than not service connected. Okay, great. But sometimes that alone isn't good enough for the VA. They want to know, well, why? Why is it service connected? And that's where the Nexus letter team comes in. We say, yes, it is more likely than not service connected. And then the Nexus letter team does a deep dive into the research and tells you why. So it's statement versus letter, and they both are important, and they just serve different functions. They work together. They have a synergistic effect on your claim.
Yeah, but they are designed to work together, not at all replace the Nexus letter, because the Nexus letter, that's when they're spending a lot of time looking at your records, both medical and military, and saying, okay, this makes sense that these headaches are related to your service connection. On the diagnostic side, on our side, we want to have that brief conversation to make sure that we're, okay, yeah, this makes sense, but we're not going to have near the ammunition that the Nexus letter is going to have for you when you go to the VA.
Yeah, you would definitely need an appointment, especially if you have new medical evidence that shows that there are some findings that make sense for you to have these pains. But yeah, you definitely need an appointment. That's definitely something we could work with there.
Yeah. And once we get, Roscoe, once we get the diagnosis for you, it's a real easy transition over to the Nexus letter team for them to do further evaluation on your service records, further evaluation on your medical records. And then they're going to be in touch with you too. You know, when the Nexus letter does their review and their research, they're also reaching out to you via email or phone to have conversations to make sure that they're getting the report as accurate and thorough as they can. And they've got research from other medical professionals that they're able to use to support the statements that they're making as well.
You are actually the perfect candidate for someone who needs a diagnosis, especially if you were denied it before. You're going to need the diagnosis. You're going to need the Nexus statements that say, hold up, VA, this is likely service connected. But then you also need the Nexus letter to explain why. You're the perfect candidate for both, for sure.
Yeah.
So the VA doesn't use DBQs anymore. So we can do the initial diagnosis. Our IMO is replacement for the DBQ. So we used to use DBQs until the VA stopped using them. So the IMO that we have has the same information that we would have put into a DBQ. And again, our IMO is going to have the diagnosis and the Nexus statement. So you just wrote Nexus. So I'm not sure which one you're asking, but yes, Telemedica can do both the IMO with the Nexus statement and the Nexus letter. So yes, we can handle all of that.
And IMO in our world is independent medical opinion, and it's just what it sounds like. It's our professional medical opinion, independent of anything other than what you are telling us and the evaluation that we have and the criteria that you meet. And once we get that on your initial evaluation, we'll put our Nexus statement in there and we'll get you sent over to the Nexus letter team so that they can get you service connected. But yes, we can certainly do that.
Yeah, so there's many different causes of GERD. So yes, you would still, we can talk more in detail with your evaluation, but yes, short answer is yes. There's a lot of reasons people have GERD, and you can have GERD without having damage to your esophagus. It takes at least 10 years or so before you start to see the damage to the lower esophagus. So that not having a finding on your EGD does not disprove that you have GERD.
Correct.
So you would have to have the diagnosis from your psych doctor for whatever psych condition, but the short answer is it's not impossible, but we would need to talk more offline about that.
Yeah, I think that is something that we could separate that and have that discussion and get you those easy to get the tinnitus. Insomnia, we may have to have a separate one from your psychiatrist, or you may have to have a separate one from your psychiatrist. But
insomnia is a very common symptom with many psych conditions. So, I mean, as long as you have the diagnosis of that psych condition, I don't think that would be too difficult.
Yep.
Actually, you're the perfect candidate for an IBS diagnosis. Yeah, diagnosis, if all the tests usually come back normal in IBS. So you're actually the perfect candidate for an IBS diagnosis. So yeah, sign up.
And hopefully your VA coach can get you access to us real easily, get you signed up to see us. And then once we do that, we'll get you rolled over to the Nexus letter team so they can work on your Nexus letter, get you service connected. But that's not a problem at all. You're a perfect candidate.
But this is an example of for you. So I would see you, if you meet the clinical criteria for IBS, I would diagnose you with IBS, because IBS patients usually have the colonoscopy, blood work, all of that normal. And then if the VA still isn't happy with that, that's why the Nexus letter is so important, because they will cite the research in their Nexus letter that 90% or whatever the percentage of patients it is with IBS have normal colonoscopies, have normal blood work and things like that. That's why it's important to have both. You need the diagnosis and the nexus statement, declarative statement. Yes, this is more likely than not service connected. And then in your case, the nexus letter would go into great detail why it doesn't matter that all of your stuff is normal for this particular diagnosis, because most patients with this particular diagnosis have normal studies. And they go into great detail. They cite research articles. That's why the more information and the more data you can present with your claim, the better off you're going to be. And you got to look at this as an investment. Okay, so not only for the monthly check, if you get service connected, yes, that's great. I'm not denying that at all. But if you can get something service connected through the VA, that means the VA has to take care of it medically. Okay. And for a lot of these diagnoses, as with most diagnoses, unfortunately, time is not your friend. A lot of these the pain will increase, your symptoms will get worse, and you want to have access to the medical care that you need in the future. So. I'm not seeing any more. Are you, Dr. Hamilton?
I'm seeing some on this. I'm trying to like see which. Sometimes.
Sometimes, yeah. I guess that would be the best answer. Would be sometimes.
Yeah. Sometimes it can. It depends. I mean, if you've already got the diagnosis and you need the service connection, then yeah. I mean, if the Nexus letter is able to say, look, your medical records are pretty much up to date, we don't need anything else. That's really going to be a Nexus letter writer question. But the answer is yes. It's entirely possible that that may be sufficient. I don't know if we mentioned, see someone here ask chronic bronchitis we can evaluate for. I don't know if we mentioned that, but again, it's a chronic disease, so we can evaluate for that, especially in some of you who've been in the Middle East where there's a lot of sandstorms and all the other stuff that you're dealing with out there.
Restrictive airway disease, things like that. Usually it has characteristic findings on chest X-ray and PFTs, and it's not that difficult.
Gastroparesis can be connected to GERD and IBS. They're potentially related, yes.
So I think we're going to take just a couple more questions before we wrap up here.
So, yeah.
Acute diverticulitis. So that's kind of two different parts of the GI system. Usually they're not related, but it might be related to other things. So that would be more of a conversation we need to have offline.
So there was a question. There was a veteran that had three questions, and we're going to try to get to. I'm sorry, they're on the side. I'm trying to track all the different questions, but there was a DDQ from an outside physician with a Nexus statement saying that the motor vehicle collision or accident from a military assault was denied. And they also denied PTSD. Because he's in Texas and I'm in Georgia. That, again, we have not seen that to be a problem. I will, however, tell you that both Sabrina and I are in Texas. So if that's something that you feel like would be beneficial to have, you can. But since telemedicine has taken off with the COVID-19 crisis, we have not seen a challenge between states. However, if you need that PTSD evaluated, because you said you're in Texas, no, I'm sorry, you're in Georgia. Okay, sorry, you're in Georgia, but we're in Texas. Okay. That having been said, I haven't seen that to be a problem in the past 6 months because telemedicine has become so common and popular. The VA has not been pushing back on, oh, your provider was in a different state. I can't speak to the psychiatry and psychologists side, but I can tell you on the medical side, on our side, we're not seeing that to be a problem. I know you had two other questions, and I'm going to try to find them. Sorry, we haven't been able to get to everybody's questions. I know that a lot of you have great questions.
Telemedica or telemedicine is here to stay, even when this COVID crisis is resolved and things go back to normal. I mean, most of the big organizations have embraced it now and have made, appointments into the schedule for remote appointments. I mean, even my mom's specialist, her follow-ups are all now remote, just because it's easy. It's easy for the patient. It's easy for the providers. A lot of these regulations that have changed to allow telemedicine to grow in this time frame, there's a lot of legislation being pushed to make those changes permanent. So I believe that telemedicine is here to stay now.
It is, and it's been really advantageous to patients, to veterans, everybody. So it's going to be here to stay. And if we didn't answer your question today, I apologize. We had lots of questions, lots of great questions. I hope we at least gave you some insight into what we're capable of doing. Now, some of these questions we're going to need to talk to you further about, offline. And hopefully your veteran coach can guide you as well. So let's try to get 3 or 4 more questions if we can.
So that would definitely need a conversation offline. We would need to know why it was denied so we know which team you need. Because with just that information, we don't know if you need the diagnosis team or the Nexus letter team. But yeah, it's definitely worth a conversation. So with the denial letters, they usually tell you why. But yeah, that's something that we can look into for sure. Now diagnosed, can it get connected? So there's that's a conversation we need to have more offline. We need to have more information. Not impossible, but we need more information for sure. Well, congratulations. We're happy to hear stuff like that, for sure. You're very welcome.
Awesome. Awesome. I know that there are lots of more questions that y'all have, and we'll try to answer these questions offline and help wherever we can. Certainly hope that this has been beneficial for you. And again, we appreciate all that you do for us. We thank you for your service. We know that this is challenging for a lot of you, especially that your background is don't complain, suffer through this, and that's awesome. It really is. But now there may be a different time in your life where you need to step up and say, hey, this is really plaguing me. This is affecting my ability to work. It's affecting my ability to provide for my family, to spend time with my family. And we need to work on doing what we can to get you service connected, because that's a benefit that you really need. Certainly, we want to guide you however we can in terms of seeking the right professionals to manage that symptom or that disease state. But in the interim, we want to help you get connected. We want to help you get the service disability that you deserve and that you need. I know we didn't get to everybody's questions. I apologize. We tried to get to as many as we can. There were lots and lots that came in, lots of great questions. Certainly hope that we've given you an insight into what we're able to do, and also some foresight into the benefit of having the Nexus letter team and the diagnostic team under one umbrella, so that I'll be able to lead both of those groups. And Sabrina's been fantastic. She's going to knock all of this out. And when I see her reports, They're detailed, they're thorough. And when I see the Nexus letter reports, the same thing. We're going to be unifying our quality. We're going to be keeping up to date on all of our training so that we get the best product and service out to y'all that you deserve and that you need. Again, if you have any problems or anything, don't hesitate to reach back out. We want to know if there's something that we overlooked or that we missed, and try to have that conversation with you. Thank you very much for tuning in. I know we've been going almost an hour now, but I really do appreciate it. And I hope you all have a great day. We look forward to working with you in the future and helping out wherever we can.
Yes, thank you.
Yeah.